Welcome to the Decision Lab podcast, the sanctuary for wellness professionals like therapists, coaches, creators, and more who are looking to over-deliver to their clients.
We uncover the truth behind cutting-edge wellness products by going straight to the founder.
We use our backgrounds in neuroscience, chemical engineering, and marketing to ask the hard questions in order to eliminate bias, misinformation, and fancy marketing language.
Allowing you to make better wellness decisions and recommendations for yourself and your clients.
So if you're a leader in the health and wellness space, welcome. This podcast was designed for you.
Join us every week for interviews that will change how you think about wellness. Hello, everyone. Welcome back to the podcast. This is Chloe here. Today, I'm really excited to introduce you to Dr. Jana Rieger. She is such a dynamic force in the world of health tech and is the brains behind TrueAngle. They're an Edmonton-based startup. I'm also an Alberta girl as well, so I'm a huge fan of all the work that they're doing. And they're really shaking things up in the health industry. So she has a PhD in respiratory kinematics, and so she's an expert on studying the way that we breathe. Jana's been a professor, a clinician, a researcher, and now she's an entrepreneur for over 2 decades. And her latest creation is called Breth. And it's this really cool wearable device that uses haptic technology and smart sensors to help people stay on track with their breathwork. And so Jana's all about bringing healthcare into the home, making it easier for folks to manage and not have to have constant hospital visits. And her journey from academia to the startup world is really inspiring to me and a lot of other female founders. And she's really demonstrated how to, change her scientific know-how and create that into a business. So I'm really excited to invite Jana onto the podcast. Welcome. Thank you so much for coming.
Oh, it's my pleasure, Chloe, to be here today. I'm excited about this conversation.
So I think, before we get started, let's talk a little bit about your background. I know that you have a personal journey with anxiety. And so tell us about that and how that led you to study respiratory kinematics and eventually start TrueAngle.
Yeah, it's a little convoluted. And I'll start back in high school, actually, when, I can remember going to a movie with friends, and it was my first experience with what probably was a panic attack. At the time, I didn't know what it was. I just knew I was in the theater. I was like, oh my God, I feel like I can't breathe. What's happening? I need to get out of here. And took me by surprise. As a high school kid, I wrote it off and I was like, oh, well, whatever. I'm okay now. And I didn't really have another event until I was an undergraduate in university where this time, same sort of thing, but a little bit more prolonged. My heart was racing and all the typical signs and symptoms of panic anxiety. And I thought, oh my God, I'm dying. I better go see my doctor and find out what's wrong with me. And she was great. She said, oh, Jana, you've had a panic attack. I'm like, a what? I didn't even know what that was. At the time, it was, there wasn't a lot of pharmaceutical intervention. It was just kind of like knowledge about what this was and like something to deal with it. I'm grateful for that, actually, because it wasn't something that, looking back on my life, that I would have needed. It was more of a on-off thing with anxiety in me. So fast forward to doing a PhD, and I was looking for a solid topic that I could really sink my teeth into. And I was going down the hall of one of our buildings and walking past Dr. Jim Argo's office. He was someone who had a high-level spinal cord injury, and I could hear him like screaming at his computer, basically. And I'm like, what's going on? And he was saying that he had just gotten this new speech recognition system, and that was his way to interact with the computer. And he was really frustrated with it. And as I looked at that, I thought, oh my God, this is his only way to interact with a computer. And it's putting him into this state of definitely anger. I'm sure there was some anxiety there, but it led to this whole journey of understanding about repetitive strain injuries of the voice, because I was really interested in the voice. But at the base of that is breathing, right? And that's what powers everything. And so in the PhD, what I looked at and what became the core of that study was looking at what's known as respiratory kinematics, which is this motion of the respiratory system related to volumes that are exchanged, and looking at what happened when people got onto using these systems. How did their breathing change? How did these systems create situations where there was we didn't measure anxiety, but there was definitely anger coming out, and we were measuring vocal characteristics of frustration and anger. So that was coming out. And that led into, when I finished my PhD, I went into an institute in the city where we were working with people who had head and neck cancer. So the breathing on hold for just a little bit, because as I started working with that population, of course, there's a whole lot of mental health issues that go into a cancer diagnosis, especially one that's in the head and neck region, because this is our identity, it's who we are. Big thing that happened was that because of the treatments that patients went through, they often lost the ability to eat normally and swallow normally.
Okay.
And so I really wanted to help them with that. And we knew that there was an exercise program that if we could get them on that, we could potentially help them to get better. So that started TrueAngle with actually what was our first product, Mobility, which is a biofeedback device for swallowing disorders. But what we quickly learned in that journey was that there is a ton of anxiety associated with having a swallowing disorder. Because imagine every time you go to swallow, there's this fear of choking.
Oh my God. Yeah.
Like every single time at every single meal for the rest of their lives. And so that really eventually led the team into Breth. I should mention the other thing that's a big side effect of a swallowing disorder is having stuff go down the wrong way into your lungs and end up with aspiration pneumonia. So it's really important to have a healthy respiratory system that's active, that's being engaged. And so all those things, that whole journey of like my own personal experience, the experience with patients came together. And when the team was looking for what is the next innovation that we're going to be looking at, we stepped into Breathwork and Breth.
Wow. And so are you finding that when you were working with these patients that have trouble swallowing, that once you were able to kind of get them back into normal breathing, calm their anxiety, that were they able to like have improvements in swallowing as well?
Yeah, so that's definitely, it wasn't an area of study that I've been involved with, but there are other researchers. Dr. Lin at Fresno State University has been looking at this in head and neck cancer patients and looking at what are the effects of reducing anxiety around being able to swallow in patients who have head and neck cancer. She's also looked at patients who have COPD. And there's another area of swallowing that is becoming more prevalent, where it's not necessarily a disorder that's associated with something like a stroke or cancer or Parkinson's, which were the typical reasons that someone would end up with a swallowing disorder. There's a whole new group that appear to be directly related to anxiety. And so the name for it is muscle tension dysphagia. And Christina Kang, who is from the University of Miami, has worked with some Mayo Clinic researchers to document this and to really understand how anxiety and how breathing plays into swallowing, because it shares the same track.
Yeah.
That it goes together. And for that particular type of swallowing disorder, lots of younger people have it. They're being told that it's all in their head. And in fact, when we look at what's happening with the muscles, they're tense, they're engaged, causing a problem. And so it's a matter of like resetting the system, calming the system. Part of that is breath work. There are some other things that clinicians like Christina do to help patients through this. But so there's this real connection between those things. As we were developing Breth, however, what we understood was that the market for breath work and for the relationship to mental health is just so much bigger than just within the population of people who have swallowing disorders. Broadened our horizons as we're looking out there in terms of how we apply this technology.
It's incredible. I mean, for me, like breath work and learning how to breathe properly has completely changed my life. And so what were some of your biggest learnings when like studying the breath? Like, do you have any kind of common misconceptions or any information of what optimal breathing looks like?
Yeah, for sure. So I think it's interesting misconceptions about breathing. I think one that I've heard a lot, especially as we've been out there talking about breath work and breath, is that people will say, well, I'm breathing all the time. Why do I need to do breath work? Right. And so I would say that most people are breathing to exist. Of course, we have to, but it doesn't mean that we're breathing for our optimal health. I think that, so many people are breathing up in the chest versus the diaphragm region, which the PhD research I did when people were getting mad and freaked out at these technology systems, definitely the breathing came up into their chest versus in the head. I think that another misconception is that, well, I only need to do breath work when I'm anxious. And yeah, that's great. But I would say that what the research shows is that laying a foundation, so regular daily breath work practice really helps engage that parasympathetic, which is our rest and digest system, and takes us out of that chronic fight or flight that most of us are in. And so it sets the stage for calm. And I'd read an article where Dr. Richard Brown, who's a researcher in breathwork, was quoted saying, doing breathwork only when you feel anxious is like brushing your teeth only when they're falling out, right? Yes, it makes sense to do it when you're anxious, but it is great. And I would say personally, from my perspective, better to have that base. So I think that's another misconception about it. And I think the other thing is a lot of people think that they're aware of their breathing when in fact they really aren't. They don't, they're unaware that when they're engaged in a task that takes a lot of cognitive load or email, something that's stressing you out, that you're holding your breath and you don't even realize that you're doing it. So I think those are some of the common misperceptions about breathing. And then you would ask, so what is optimal breathing? Yeah, that's a good question. I mean, it kind of is dependent on what we're doing, right? So whether we're active or we're at a sitting, resting state. But I think in general, when we're not exercising, we're just sitting. Usually we're breathing in and out anywhere between like 12 to 20 breaths per minute. And that if we can engage the diaphragm breathing, that would be optimal. So part of that is also posture. Like when you're sitting at a desk, and so many are sitting at desks, right? Teens in school or your adults. And it's so easy to get into a slouch position. When you're in that position, it's really hard for the diaphragm to engage fully. There was a study that looked at, this was out at King Saud University, and it looked at what happened when people were put into the head before shoulders position, like the head forward position.
Okay, yeah.
When you're looking at your phone, I'm sure you've seen lots of people even walking around. Just look at where are their ears in relationship to their shoulders.
Okay.
At a device. It was when people are in that posture, the diaphragm can't contract optimally. So I'd say optimal breathing is about posture. Also some suggestion that it's great to every once in a while get into what's called resonant breathing, where you slow your breath rate down to about 6 breaths per minute. It's not like you carry this out all the time, but that aligns our respiratory system and our cardiovascular system. And it can also that decrease in anxiety.
Cool. Okay. Tell me a little bit more about breath. Like, how does it work? And how did you come up with this idea? I know there's also like an app that goes along with it. I'm patiently waiting for its full launch, so I can't wait.
For sure. I feel very lucky or fortunate because I get to use the product ahead of time. We have the beta versions out. We're using them, testing them. And so I've had the benefit for the past 2 months to be using it consistently. So what it is, there's a device, you wear it around the neck, and there's 2 things that are important about the device. First of all, it senses your breathing. So it can set a baseline for the exercises that you're going to do in terms of like how deep should you be breathing within those exercises. The second thing the device does is it has what we're calling haptics in it. So it delivers vibrations to your chest that basically are a code for telling you how to do the exercises. So there is an app. And there's also visuals and auditory that go with it. And all those things line up with how the device is vibrating. So you can use all three to guide you through the exercises, or you can choose to just use haptics if you wish, which sometimes I do because I just like the quiet. And there is really something about, for me, that sensation that it's like a magnet and it just zeroes me in and the crazy racing brain stops. So for me, it's like a gateway to having a quiet mind.
Wow.
So there's different exercises in Breth. Right now we have 3 that we've programmed in there. Like I said, they're personalized to you based on the baseline that we get. There's also a section of experiences, which is where you don't actually work on breath work, but they deliver vibration. They are meant to get you ready for what you're doing. There's some music associated with them, and the whole experience is meant like, okay, let's get ready, let's focus, let's go. So you asked how it started. As I mentioned, it really came from this experience with this other technology that we have. And what we understood very clearly was that there's a couple of things that make this important. And one of the questions that I have been asked is, there's so many free things out there. Like there's free apps. Why do I need this? And what we know is that people need help with sticking to a routine. So adherence is really important. And, until you start measuring something or you have a device helping you with something, you don't realize how potentially non-adherent you are. And that's why Fitbits became so popular, because it's like, we all think we're walking a whole lot. And then you put a Fitbit on and you realize that, oh my God, to get 10,000 steps, I have to do a lot more. And so I think with a product like Breth, what it's doing is it's keeping you on track. It's keeping a record of what you're doing. It's telling you how to do it. So the other thing, again, as I've mentioned, we're not so in tune with our bodies. And when we think we've inhaled for a certain amount of time and held our breath for a certain amount of time, we actually probably haven't. And so this really helps keep you on track for okay, I don't have to count seconds. This is telling me exactly when to move through the motions of the breath work. So it's all about that biofeedback, about what you're doing, how close you're getting to doing the exercise, and then really staying on track with a program.
Oh, that's super interesting. I think that's the one thing that I find really exciting about the device is it's not only telling you what to do, it's collecting data. And so over the long term, what data is it collecting and what is it telling you?
Yeah. So right now, we have lots of ideas about where we're going to take this, but right now, what data it's collecting is around respiration. So the respiratory sensors in there are understanding when you're inhaling, when you're holding your breath, when you're exhaling, essentially, and relating it to the exercises that you're doing. So essentially, we would be able to tell. So for box breathing, if you imagine there's a box where you're inhaling, holding, exhaling, holding, we would be able to tell you how close are you really getting to doing that based on what we're sensing from what you're doing during that exercise. So those are some of the data that it's capturing right now, very focused on breathing. I think what'll be exciting in the future will be integrations with other types of devices that measure things in our body. So I'm wearing a Whoop, there's Oura Ring, there's Apple Watches, but these things that measure our sleep, our heart rate. I purposely purchased the Whoop because I wanted to understand how was what I was doing with breath and breathing exercises affecting what was happening inside my body. And it's been so really exciting to see things like, man, when I start doing, say, diaphragmatic breathing, within a matter of maybe 2 minutes, I can go from having, a heart rate that's somewhere around 80, dropping down to a resting rate that's close to 50 and just kind of flatlining. And it's amazing. Wow. I would never have known that. So I think those integrations with other technologies is where things will be really exciting as well in terms of understanding what you're doing with your respiratory system and how that impacts your body.
Absolutely. That's so exciting. I want to zoom out a little bit and just ask about your journey as a founder. What were some of the hurdles that you've had to overcome, especially you had to transition, from academia to founder and CEO? Like, what was that like for you?
Yeah, it's interesting. It was definitely a journey, Chloe. I would say that it came to a point where I knew I had to do something. Otherwise, I was not going to get the technology that we created in the lab through grant funding out into the world. And so it was kind of like that push. But there was this feeling of like, I'm not sure, like I'm really good in my lab. I know how to get funding and I know how to do all that stuff, but running a business is different and I'm just not sure what to do. So there was some, I would say, fear and trepidation about like stepping out of something I knew so well into something that I knew very little of. I always loved business. My family was entrepreneurial, so that wasn't something that I was afraid of and in fact really liked. And so for me, it was kind of exciting because it's like, wow, I get to put together this thing that has always intrigued me, which is business, with a passion of what I've been doing in the healthcare sector. But I definitely needed help. And what was super important to us was we got involved with an accelerator, the Creative Destruction Lab, and some really good mentors around us. And I think that is key. So for anybody who's looking to make that jump, finding the right people to support you, both on your team and external to your team, are just super, super important.
What's helped you overcome that fear and trepidation? Because, I have been there before with, my own companies or stepping into a higher level version of myself. And it's really scary. And your whole nervous system often sometimes freezes and goes, no, this is too much. So what have been your, tools, practices, or mindsets that have really helped you overcome that fear?
Yeah, I love this question. It's so deep, Chloe, actually. I would say initially overcoming the fear was just really naivety. That's what it was. I didn't know what I was stepping into. There was this kind of bliss for a while where you're just learning. And then, as you know, in a business, there's stuff that happens. Like there's great passion about what you're doing, but there's a lot of people relying on you and there's a lot of people that you're answering to. And there's so many more things to think about and do and pressures. And it's like, holy crap, if you want to talk about like when the anxiety ramped up in my life again from that undergrad university experience, it was as an entrepreneur. And, I think for me, it was like, I need to get a hold of this. And so I thought, okay, at first it was really an internal journey for me, like understanding why am I feeling so anxious? What are the things that are setting me off? And what can I do about it? And initially, like trying to talk myself off a ledge never worked. Not a good strategy at all. And in fact, at that point where, I was facing anxious moments, meditation wasn't the right thing for me at that particular point either, because my mind was just too fully consumed on like the freak out.
Yeah.
And so then I got crafty and started doing things like avoiding it. So it was like, oh, if I get up and get out of the house and do this, then it goes away. If I get up and I work, if I get up and binge on Netflix, it goes away, right? So it was kind of like that distraction, but that only works for so long as well. So, I think what was really important for me was, again, getting into breath work at that base for like really bringing down that fight or flight chronic state that I'm in. And then what that has allowed me to do is it's allowed me to meditate, and it's allowed me to separate that voice in the head that's like telling you all and so future focused and creating anxiety about what's going to happen in the future and how do I control that. And so it's really allowed me to step back and see that and be like, okay, whoa. This is what I need to understand why I'm attached to that particular outcome. There's so many variables. And I think for me, I've learned that if I try to control, it's a recipe for disaster, And so there's a little bit of this whole thing of letting go of some of those attachments about it has to be this way or it has to work this way, and just becoming more open by slowing that voice down and like telling it to just like relax. Been a few things that have come together for me in terms of coming to grips with that and not, with the distraction strategy and getting into work. That was just like insane behavior because still freeze. It didn't give me that break that I needed for like a good mental health break. So bad strategy. I do not recommend it.
Yeah, I feel like that strategy often tends to lead to burnout. Yeah, I've burnt out many a times. I think founders often really, really struggle with that. And then once you've reached burnout, there's kind of no going back. It's like, okay, now you're burnt out, and now you need time off, and you need to rest, and you need to treat yourself like as if you were sick. And so it's so good to like stay ahead of it.
Absolutely. 100%.
You've already shared so much helpful advice, but I'm just thinking, do you have any other advice for maybe new entrepreneurs that are looking to start a company in health tech or biotech? Like, what were some of the golden nuggets that you learned that you're like, oh, if I were ever to do it again, I would, absolutely do this or absolutely not do this?
Yeah, I think it kind of depends if you're starting in academia or starting outside of that. There's definitely some challenges if you're starting it in academia that are a little different in terms of like who owns the intellectual property. And that brings a whole other level of recommendations that I would have for people. But I think if we just say general for someone who's looking to start a business, the first thing is to find your network of people. And people who have done something similar can tell you about their battle scars, who can help guide you. And I would say the second thing that really would have been that I would do different and that we are doing differently now with Breth is understanding the market to like just an nth degree sort of thing, and really getting out there and finding out from the market. I think with mobility, because we were clinicians, we understood the need and the desire and the benefit of this technology. But I think we were naive about the market. We were naive about healthcare, about how decisions are made in healthcare, about how slow the healthcare system can be in adopting new technologies. We're quite naive about that. And so now with Breth, we're positioning it as consumer health and wellness. And we're out there now constantly every day understanding about the market. Who is our ideal customer? Who is showing the most interest in this? Who is coming forward? So I think for new entrepreneurs, knowing that, like really digging into some of that, even though it seems kind of scary that you'd go out there and talk to people about your idea before it's launched or whatever, or they might tell you it's not a great idea. Whatever the fears are around that, I'd say just like boot them to the curb and get out there and really try to understand your market.
That's so helpful. Yes, because I think founders have a tendency to fall in love with their product and before they even have product market fit. And so it's really important to make sure that it's a product that people want. Absolutely. Okay, so looking ahead, I mean, you're such an inventor. You've already created like 2 really cool products. Where do you see the future of health tech going? Like, what are some things that excite you? Maybe like, in the next 5 or 10 years, what do you see coming?
I really love this thought that more data is going to be in the hands of, let's call it the patient, the end user, and that we will be able to run studies that are based on real world evidence. Having come from academia where our studies are very sterile, their groups are picked very specifically. There's a reason for that, and there's a place for it. But I also think that it's really important for us to really understand what's happening in the real world and use this big data that we get from all these different wearables and things that are giving us insights into the body to help people live even better. And I think clinicians don't need to be afraid of that. I think that it will actually help them be better clinicians. So that's where I see the future going. I think as humans, we'll just have so many more insights into our health and the effects of different things on us.
Yeah, absolutely. What are your kind of current thoughts on AI and how health is evolving to use AI? Do you foresee yourself like strongly implementing that in your products in the future?
I don't think there's any way that technology companies can stay away from that. I mean, there is so much power in it. I think we have to understand the limitations of it. And where a human-to-human interaction becomes important. There was one story I love, and I'll share it quickly. Really highlights this, and it was from a colleague who was working with patients who had diabetes. And this woman's readings were off, her meds weren't working, and it was like, well, okay, maybe we should just, up your insulin. And But he said he took the time to actually have a conversation with her. And what he found out in that conversation was that she actually had gone through a recent breakup. Her partner had been the one who always made sure she took her insulin on time and was really a support for her. And she had lost that personal support. And so, in fact, what really had gone out of whack for her was something personal. So I think that where AI becomes powerful is it does a lot of what I would call, maybe this isn't the right term, but I'll call it that anyhow, grunt work.
Yes.
Takes all these big numbers and it crunches them so that the clinicians who are interacting with people can actually be more empathetic. They can be the ones who are like looking at that whole person. Yes, we have data, but there's a whole person there. And we all are living on this earth and we're all having experiences that aren't necessarily medical, but that affect us, affect our health. So I think AI will be so important, but that it's not going to replace the clinician.
Yeah, I fully agree with that. Like, I thought I always had with AI is obviously there's going to be negative use cases and people will abuse it, but I hope that it will actually just help us human better. Like, it'll allow us to tap into the things that actually make us human beings, like the compassion, the connection, and it'll give us more time and space for that. So I completely agree with you. Okay, now we're getting a little bit close to time, so I think we'll finish off with, we have these rapid fire signature questions that we ask everyone. So let's start with the first one is, what book do you recommend the most often?
I love The Four Agreements by Don Miguel Ruiz. I think it's little, it's short, it's like a primer on life. And if you can follow it, it can bring a lot of happiness.
I completely agree. That's a great book. Okay, the next one is, what's one question that you wish people would ask you more?
I'd like them to ask, what is it about entrepreneurship that gets you out of bed in the morning?
Jana, what is it about entrepreneurship that gets you out of bed in the morning?
Yeah, for sure. It's creativity. I love being creative. And I've done other things in my life that are very, what you would consider as more traditionally creative. But I think being an entrepreneur, you have to be super creative. And that's the exciting part of it. It's like, okay, what's happening today? And how are we going to deal with that? And that's the positive. We hear a lot of like, what's hard about entrepreneurship? I like talking about that. Also, the super positive side of it is that exciting creativity side.
You're creating. Oh, I love that. That's really impactful for me too. Keep that in mind when things get hard. It's like, oh, you're creating, you're problem solving. You're doing something that hasn't been done before.
Exactly.
Okay. If you could share only one tool or concept with the world, what would it be?
I'm going to say Breth.
That's like a softball to you. Yeah. Breathwork.
Thanks, Chloe. Honestly, it is life-changing. Really, getting into a breathwork practice is really life-changing. And again, being a research nerd, the research is there to support it. There's great research to show it decreases anxiety, decreases blood pressure. It's incontrovertible evidence. He is sticking to it and getting that good practice.
Do you have any specific breathwork practices that are maybe your favorite? Like, some people love like the holotropic breathwork. Some people love pranayama. We talked about box breathing. Is there like a specific one that you love, or do you kind of just do it like as a flowy basis, like whatever you kind of feel like doing?
I'd say there are two that are my favorites. So I do like box breathing. I think that the fact that Navy SEALs use it to keep themselves calm and on target is resounding support for it. So I do love using that one when I'm preparing for something. When I chill, it's all about resonant breathing. So it's about that regular inspiration, expiration, diaphragmatic activation. That is my ultimate favorite. Can put my racing brain to sleep in like no time. So that's my ultimate favorite. Simple, but awesome.
And then last question is, what are you becoming?
My goodness, I'm more comfortable in my own skin, really, as time goes on. And I've made a lot of non-traditional decisions in my life in terms of, I've written a book, a novel, started a company. And in that narrow academic life, those kind of things were seen as like, what are you doing? You're kind of venturing off the highway here. So, and at points in my life, it was like concerned about, okay, what do other people think? Kind of at the point where I give less of a about that, right? And just more of like being comfortable that these are the decisions that I'm making, and I'm really happy with them.
I love that. Being more comfortable in your own skin. Okay, and as we conclude, where can people find you or follow your work?
So there's a few places. I'm active on LinkedIn, probably maybe sometimes too active anyways. And then also our website for Breth is Get Breth, and Breth doesn't have an A in it. It's just BRETH, so getbreth.com. We're on Instagram. Our handle there is Breth Tech. We're also, I'd say that kind of covers our main online presences where you can find us.
Perfect. Well, Jana, thank you so much for your time and all of your wisdom. It was really wonderful having you.
Yeah, thanks, Chloe. I appreciated the conversation.
Everyone, stay tuned and make sure to follow along with their journey.